afternoon. We are here for the CARES Act Steering Committee. We still have a couple of members that have not joined us, and I believe they will join by the end of the call. I did not hear from anyone saying they would not make it. Cindy Gillespie, Secretary Gillespie from Department of Human Services. That might be her that just called in. Thank you. And there she is. And then Senator Dave Wallace and Representative Michelle Gray, who I believe they're both going to be on today. They just may be taking them a minute to get in by phone. So I would like to go ahead and get started with a review of the minutes that I sent out from last meeting from the 15th. Does anyone have
Motion to approve the minutes.
Thank you. Motion to approve. And second, all those in favor?
Aye.
Aye.
Aye. Aye. Aye.
Thank you. Any opposed? Okay, we've approved the minutes from last week's meeting. Thank y'all so much for having this meeting again quickly. I know things are kind of crazy. We're trying to make sure that we can meet our deadlines so that we can provide information to the ALC. We have a request from DFNA that is on our agenda. I think we probably need a motion prior to that request. So is Secretary Walter, you want to kind of explain what you would, or do you have a motion first?
Do you want, I'm not sure what you're
Suspend the
saying.
rules.
What's the motion for?
To suspend the rules.
I'll make a motion to allow for the proposal by the FNA to be considered at this meeting. That's my motion.
Thank you, Senator Urban.
This is Greg Bledsoe. I second.
Thank you, Dr. Bledsoe, for the second. All those in favor of suspending the rules to allow for this proposal to be reviewed here today?
Aye.
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 And Senator Wallace has just called in. I guess I'll catch him up. We've just had a motion and a second to suspend the rules to allow for a proposal to be brought forward by DFNA that you should have received regarding the compliance software. So he came in the middle of the vote. Do you want to participate in that vote, Senator Wallace? Okay, thank you. Are there any opposed? Okay, so the motion is passed. Secretary Walter, please go ahead and explain your proposal and give us a little bit of background. I think this proposal will also help us to be able to address the other proposals that we'll be dealing with in the future, as well as those that have come before us. Go ahead.
Okay, first of all, I'd like to thank the committee for suspending the rules to allow me to explain what we would like to bring before the committee today and hopefully before review and ALC later this week. As you'll recall, the steering committee approved $150 million for cities and counties some time ago. There are 500 municipalities and 75 county governments. As we consider the eligibility determination, document gathering, and audit compliance for these different entities, it became significant concern of ours as well as the Arkansas Municipal League and the Association of Counties on how we would be able to track and monitor these requests. We determined that a database solution is required to track and to maintain records subject to legislative and federal audit due to the complexity of the funding streams and the large number of agencies awarding funds to sub-recipients. I will also point out that the state of Arkansas is ultimately responsible entity to pay back any federal funds that might be spent improperly or were deemed ineligible due to the lack of supporting documentation or justification. Also, the DHS, Department of Health, Commerce, UAMS, Parks, Heritage, and Tourism have all received funds that are being dispersed to hundreds of subrecipients, creating an overwhelming volume of documentation which must be properly captured, evaluated, sorted, and stored to meet the compliance and the audit requirements. DFA realized the challenge of internally creating the necessary database solution and the personnel necessary to carry out such a challenging task. We identified 3 nationally respected vendors and conducted an extensive review of the needs of the state and we evaluated the vendors based on those defined requirements. The vendor of choice will provide the database solution to record receipts, transfers, disbursements of funds by the state agencies and other entities with subrecipients, provide compliance documentation, safekeeping, and an audit trail. The reporting aspect will be enhanced since all detailed disbursements down to the final subrecipient will be recorded in the solution. By utilizing the database solution, scanning images can be stored for easy retrieval for compliance, audit, and reporting requirements. The selected vendor will provide the necessary services for not only the $1.25 billion out of CRF that we've received, but also an additional $500 million that we received out of the CARES Act for additional funding to state agencies through that legislation. CTEH and Haggerty have combined to make an offer, and they were selected by DFA as the vendor based on their experience, capability, capacity of personnel resources, and cost solution. I might also point out that of the three that we selected to analyze, they are the only Arkansas company of the three. The two other also nationally recognized firms, and they provided solutions priced above the recommended vendor of CTEH. CTEH has extensive experience in the CARES Act legislation and has the capability to leverage funds from all the federal sources and to identify any overlapping areas where funding may be duplicative. DFA has requested that the CARES Act committee approve $4 million to be used for contracting with CTEH to provide these services. This will allow DFA to have a solution in place quickly to meet the ongoing responsibility of the state to fulfill the reporting requirements of the CARES Act. I've covered this with the governor, and he is fully supportive of this proposal. Does anyone have any questions?
Thank you. Yes, does anyone have any questions?
I have with me Paul Lothian, who has led the team that did the evaluation.
Thank you.
Just to be clear, on our agenda, it's a request for $3.5 million, but it's actually $4 million on the sheet.
Yes, when I received the information that I received did have 3.5 million. So
Okay.
I need to update the agenda that the proposal is for 4 million.
Appropriation request tomorrow will be $4 million. Right. And we will, if we approve this today, we will have an appropriation for $4 million tomorrow before the legislature.
A request for appropriation. Okay.
Yeah.
Other questions? Senator Urban, just a question, and happy to make a motion to approve as well. But will we be able to go back? Will they be able to go back from day one of our spend and put that all in the system, or is it just here moving forward?
No, it is. It will go back to day one and go forward. And if this gets carried beyond the end of this year, they'll be with us then also.
Okay, very good. Thank you. I'll make a motion to approve.
Thank you.
Thank you, Senator Urban. Is there a second, or do you have a question, Senator Bond?
I have a question. Do we know what other states are doing, or other states using CTEH, or other states moving model to monitor their CARES Act fund? Is this something that's happening across the country, or are we unique?
Yes, there are other states that are using a similar situation or a similar solution to this. CTEH is not in another state, but they are working with some municipalities. New York City and I think Dade County is two of the ones that they're working with that they have experience with right now. But there is a lot of this going on. The other respondents also had entities they were working with at the city and county and state level.
And have we worked with this company before? Do we have any experience with them?
No, we do not, but we have viewed their product, went through a demonstration of the database that they're going to be using, asked questions about that. It appears that it will meet all the needs that we have.
Then one last question, which may sound a little naive from an accounting perspective. How does this fit with ACES or whatever we account with currently? Is there overlap, or do they fit together, or does it matter?
Well, we'll actually be able to take data feeds out of ACES and put them directly into this solution, but we'll also be able to take it from the cities and counties, anything that they have that they can pull a spreadsheet from or a report from, we'll be able to upload into this system also. If they don't have that capability, they'll be able to enter this directly into the portal in a couple other ways.
So my last follow-up would be, does this 4 million cover accounting for the whole $1.75 billion?
Yes, it does.
Yes.
Thank you.
So just to make sure that I'm clear, when I spoke with you, Secretary Walter, I also understood this additional fund. So the money that we are looking at is $1.25 billion for our purposes that we're making recommendations for. But then the state has also received additional funding, and I understand that those dollars would come through the system too. Is that right, Secretary Walter?
That's correct.
Thank you. Does anyone else have other questions?
I have a question. Representative Allen.
Okay, Representative Allen, go ahead.
Thank you, Madam. Thank you, Madam Secretary. How many other companies, cities in the state of Arkansas are using this company?
That I'm aware of, no one else is using CTEH here in Arkansas. Now, they're an Arkansas-based company that has been in business for several years here in North Little Rock, and they're also partnering with the Haggerty Group, which is a nationally known company. They have some 12 to 15 offices in the United States, and they do disaster recovery on a routine basis.
Representative Allen, this is Larry Walther. They have done a lot of work with the ADEQ here in Arkansas. They started out 20 plus years ago as an environmental company that dealt with environmental hazard issues, and then they've moved into other areas. So they've been around a long time. They're located in Maumelle, out at that industrial complex where that hospital is, and others are out there, and they're located out there with them.
Thank you.
Thank you. Any other questions?
One other, and I assume since they're putting it forward that we feel confident this group can do the job, and it is necessary to monitor the money. That's what Mr. Walter's telling us, right?
That's correct.
Yes, I would agree. And I would agree with that. From a compliance standpoint, we do want, and we've actually brought that up in a number of our meetings. Okay, so I think I've gotten out of order. We have a motion, and I think I thought I heard a second as well as some questions, so I kind of stopped that process. So Senator Urban, you have a motion to approve. Is there a second?
Second.
Yes, by Representative Jean. Now, is there any additional questions or discussion on the motion? Okay. All those in favor of the motion to approve the proposal for $4 million to secure a vendor solution for this compliance? All say aye.
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 Thank you. Any opposed? Thank you, and I appreciate the members. This motion has passed, and I appreciate the members for allowing this proposal out of order and allowing us to suspend the rules for that.
And
Okay,
I
so
thank the committee also. Thank you.
Thank you, Secretary Walther. Okay, so now we're moving on to our agenda items, which most of these items were discussed. Yes, I keep saying yesterday, sorry, I sound like my children, but last week, on Wednesday the 15th, we discussed these proposals. We have some additional information. As you know, we had a number of questions regarding these proposals. One of the things that we have to make sure of is the funding flow, where the dollars would go. We discussed with the Department of Health as well as with the Department of Human Services to oversee some of these. And as y'all saw on your agenda, the Department of Health or DHS have, they're going to be reporting on these proposals. The very last proposal on our list related to the health equity response team. We did not have them present their proposal last week, so I have them on the line to discuss and give us more detailed information. But otherwise, the organizations that have brought these proposals forward are not necessarily here for responding to questions or to give any presentation. I was planning on hearing from DHS, from Department of Health, and from DHS regarding their work on these proposals and the status for them, except for related to the health equity response team. And I just wanted to make sure that the committee understood that before we got started, and make sure that that's okay with you. And if you want to hear from them first, or if we just want to let them go in order, which is fine with me. I think that's mainly where we are. You did receive from Department of Finance and Administration late, like within the hour, a review and recommendation related to a couple of the proposals. And then when we get to the Northwest Arkansas Council, I have a change on that, which I think is documented in the DFNA recommendation. So I think that is all of my preliminary remarks. Mr. Gossage, is there anything you think I might have forgotten to mention? Okay. All right. Well, let's just start from the top. Department of Health, Stephanie Williams and Ms. Love, I believe, are both on the line. And we may, for the Arkansas Black Hall of Fame, Sharonda Love may be able to kind of speak to the kind of broad idea for these grant proposals as well. Stephanie, would you like for her to go first, or would you like to speak first?
I would just say that Sharonda has agreed to manage all of these proposals that are listed as potentially being handled by the department, and I appreciate her willingness to do so, and I'll turn it over to her for her remarks.
Can you all hear me?
Yes.
Good.
Yes, we can. Go ahead. Thank you.
Okay, so the Minority Health Commission currently has a sponsorship and or granting process that we utilize for community partners. And our plan is to adapt that process for COVID CARES Quest. And so what we would what we would recommend doing is utilizing an application process where organizations who have requested CARES funds can simply check on the application what they are requesting funds for, whether it is included for screening, testing, sub-grants, Black Hall of Fame, supplies, cleaning, education, training, and or other, and then they can specifically state what it's for, and therefore we can verify that the request would be utilized for CARES resources. We then also work with those organizations to develop, or they would submit their budgets, and we would make sure that it is in alignment with the CARES request, as well that it aligns with DFA's state procurement policies. And the organization would have to sign agreement that the approved budget is what they would utilize the funds for. We currently have a process where organizations have to request reimbursement, but our recommendation would be that we set up a process where we provide CARES funds in 3/4 or 4/4 increments where organizations are able to request funds and then submit a report along with justification for what was spent. And if the applications were spent appropriately, they would be able to request additional funds throughout this next 4 to 5 month period. And so we have verified with the state legislative audit that this process that we have decided to use is the one that would be agreeable to them. We will also work with our AG liaison to make sure that we have an appropriate agreement that is developed between the Minority Health Commission and the organizations for which have requested CARES funds. And that is the process that we currently plan to. We are in agreement with supporting all of the organizations in an effort to help decrease minority health disparities and to get access to resources throughout the state.
Okay.
So if there are any questions about any of the specific proposals, I am happy to try to address those as best I can.
I have a question.
Okay, go ahead, Representative Allen.
Okay. Ms. Love, thank you for stepping up to the plate and agreeing to do this. I need to know, will you need additional funds and resources to monitor and administer these programs?
Representative Allen, thank you for that question. Currently, my office was prepared to work with just a few of these, and so we're willing to take them all on, and we will do our best to meet the needs of each organization. If we do find that we are in need of additional support, we will make that request.
Okay. So at this time, you feel like you have the adequate staff and the resources to do it?
Currently, we have one position that we are in the process of trying to fill, but Staff Williams and I discussed that, and we're going to work on it.
Okay. All right. Thank you.
Thank you.
Thank you. And I would note, we discussed the idea of utilizing a fiscal intermediary with the Arkansas Black Hall of Fame grant, but the work with the work through the Minority Health Commission would alleviate that need. And so I think that foundation would have charged, I think, 10%, and that would have come out of those funds. So they would be able to utilize all the funds towards the grant needs. So I really appreciate Director Love and the Minority Health Commission for stepping up as well. I also do like the idea, and her sound was kind of bumpy a little bit, so I wanted to make sure y'all understood that they will be doing 4 installments for payment, so that they'll get 1/4 of the money each in August and then September, and they'll have to prove those funds, show receipts and such in order to get the next installment. So I thought that was also very good. So I'm sure there's other questions. Representative Jean, you have a question? No? Okay. All right, go ahead. Anyone have any other questions?
I have a question real quick.
Yes, go ahead, Senator Urban.
So which exact proposal? I know that Ms. Love had talked about the Marshallese, the 2 Marshallese proposals, A and B. And then the Black Hall of Fame, are those the 3 or that we're talking about, or are there more?
I think we can address.
We're gonna go through them individually.
I think we might want to go through them in order. So
Okay.
let's
Okay, I just didn't know.
That's fine. I think she'll be able to address that.
Yeah, I didn't know which ones were falling under her.
Okay, we'll go through them again. She can explain at each level. So if there's anything else specific to the Black Hall of Fame proposal, I don't think there would be. I mean, the one thing was related to that fiscal intermediary. Are there any other questions related to number 1, Arkansas Department of Health Black Hall of Fame request for $300,000? Okay, we have a motion to accept the proposal from Bill Gossage. Is there a second?
Second.
Thank you. I think I heard a second from Representative Allen. actually heard two people seconding, so. Shall I say that was Representative Allen? Is that okay? Okay, good. Any other discussion or other questions related to proposal number 1 related to the Arkansas Black Hall of Fame? Seeing none, I'll ask for a vote. All those in favor, please say aye.
Aye.
Thank you. Oh, wow. Dr. Bledsoe.
That was a different eye.
We heard it. Any opposed? Okay, I didn't hear any opposed. So the motion passes. I appreciate that. And I know that Director Love will work with the Department of Health and the Black Hall of Fame to get this moving forward. Okay, so number 2 from the Department of Health is Coalition for Tobacco-Free Arkansas. The amount requested was $50,000. It relates to educational materials to target communities of color, primarily African Americans, suffering from COVID-19 disproportionately. So is that something from Director Love or Stephanie Williams? Go ahead, Department of Health.
This one also Director Love would manage, and so I'll let her make any comments she has specific to this one as well.
So for the Coalition for Tobacco-Free Arkansas, we are in agreement with supporting it. I think there has been questions about whether this might be a duplication of efforts since they have a request to incorporate promotion and advertising. I do think that they are able to reach a younger age group, that 14 to 30 age group that previously received a message that COVID impacted older adults, and they have kind of turned off their listening. And so they might be able to specifically reach out to a population that has not previously gotten the message about the importance of protecting themselves as well as the family members that they may come in contact with. So I can take any questions about that.
I have a question.
Go ahead.
So this is Senator Urban. Thank you, Director Love. You just brought up a great point that I'm wondering if once you review this, because what you just said really is a statewide issue. I mean, honestly, it really is impacting probably that entire generation of younger teenage kids or college age kids. And I'm not sure if the marketing plan that I know we fund through Director Hurst, you know, what all that entailed or what that included. It might be a good idea for us to have a report on what's already been spent and how that needs to happen. But I would just recommend that, because that's new information, what you highlighted there, that might not have been something that we have marketed towards that population to get the word out that's specific to them and to the reason why. I think what you just said is very enlightening. So if that's the case, I mean, I know this is 50,000, but I would just ask that you would monitor that to see if there's a statewide effort that area that might need to be addressed further. That's really my main question.
I'm definitely willing to monitor. I think her proposal specifically targeted some of the southern states, but I think she is able to reach others throughout the state where we might be able to make this more of a statewide effort that reaches from corner to corner.
Yeah, no, I thank you. I would really appreciate that. I mean, I know that the Arkansas Minority Health Commission covers a vast majority of, I mean, a lot of county, not just in the south, but all the way up the east and even in my area and all the way to west. So anyway, I think that would be a good idea to look at that. And that would just be my recommendation, that if we find something good out there, that we apply it statewide and to all people. Thank you for that. Thank you for your work.
Thank you, Senator Urban.
All Are there any other questions or issues?
Motion to
Senator
approve.
Bond, yes, go ahead. I'm sorry, Senator Bond, we cannot hear you. I think we might have you muted. Hang on.
What I was asking is DFNA making a recommendation on each one of these? Did I miss that in the agenda?
So I will ask DFNA to respond. They were able to do a couple of them, but they didn't have the opportunity to. This has all happened pretty quickly. So we'll see what they're able to respond to here. If we need a little more time for them, then we may ask for that. So I don't want to push anybody on a vote or anything like that. I just wanted to update y'all with what we do have. And so this is where we are so far. Secretary Walther, do you want to speak to the proposal number 2, Coalition for Tobacco-Free Arkansas, $50,000, or do you want to wait?
My preference would be to wait. We haven't made a determination on it at this point in time from the DFA standpoint, because I didn't know enough about what they were trying to do. So I'm personally not ready to vote for it. I won't vote against it, but I probably won't vote if it comes for a vote.
I would just raise again, I think that's everybody's concern on the committee, not just mine, that we make sure we understand how all these are fitting together. There's many great proposals, but make sure we kind of have a statewide plan and approach how they fit together. And DFNA obviously plays a role in looking at these proposals from the state agencies. So that's just been a concern of mine, is how the puzzle pieces fit together.
Thank you. I agree with you.
And I agree with Senator Bond. There's several on here that probably aren't quite as urgent as the one we just discussed with regard to the Black Hall of Fame, and maybe the having to do with the Northwest Arkansas because of the urgency up there, and give us a little more time to go through and review those would be helpful from my point of view.
Can I ask a question to Ms. Love?
Yes, please, Representative Allen, go ahead.
Ms. Love, in your opinion, not trying to put you on the spot or anything like that, do you think that the Coalition for Tobacco-Free Arkansas can move forward and do the things that they outlined in their proposal?
Yes, sir, Representative.
Or you need...
I'm sorry.
Okay, so I'm not meaning to cut you off, but go ahead on.
Yes, sir. I do believe that they would be able to carry out the proposal. And like I previously stated, I think that they might be able to, because they work with the younger group focusing on tobacco regularly, I think that, that those individuals might hear messages from them that they previously have either tuned out or chosen not to listen to.
Thank you. I think it's so important that we take a look at this organization, because we still have a lot of young people that are not wearing masks, and young people that don't believe that this disease is for real. So I see a need where this organization can go out and help make sure that the message get out there, and they can foster some of the concerns that we all are concerned about with this COVID-19 disease. And the amount of money that they're asking for is such a small amount of money. It's only like $50,000. So, we can analyze this and keep analyzing it, but at the end of the day, it's still $50,000, and the need is still going to be there. Now, what we can do, we can ask her to see if she can expand it, because she's targeting the minority community and communities of color, but her reach is deeper than that. She also reaches out to non-minorities as well. So, but she just put that in there as a point of emphasis. But I know her, I know this organization, and know that Captain works very hard, and Ms. Love is familiar with them also. So I think that we ought to really take a look at this one today.
This is Senator Irvin. So thank you. I think we should wait. I think DFNA, we set up a process to review these things. We have just hired a compliance proposal, and I really don't want, that's going to be able to help us identify where there could be potentially duplication or what the best use of this money is. And I really do, if we have a good idea, then it needs to be a statewide plan that's really for all of our Arkansas citizens. And if it's a good idea, then we need to revisit that. It has nothing to do with the agency or anything like that. It's really about following a process for me. So I personally would prefer to wait until next week, or to where DFNA has the opportunity to review this. And I look forward to the compliance partner that we've just approved assisting us in that. So that's just my 2 cents as well. I just wanted to chime in. Thank you.
Okay, comment.
Yes, go ahead.
If we're going to implement that process, then what we should do is just go back and halt everything and let DFNA do an evaluation on it. And then we can decide whether we're going to move forward based on the firm that we hired and based on what DFNA's opinion is, instead of just hammering, drilling down on these proposals that's in front of us today. So we should get to go back and retroact it.
Secretary Walters, do you want to speak to that regarding the contract that we have just approved? I'm not sure that contract is that much.
And all of that.
Or was that?
Detail. I think there might be a misunderstanding.
Who asked that question?
Representative Allen.
No, who asked the last question for me to address it? Was that you? Or Senator Irvin?
So I think
what's the question you want me to answer?
All right, well, maybe I can explain it. So Representative Allen has a concern that maybe we should look at all the proposals that we've already approved through CARES Act and stop and undo what we've done and put them all through the
Screening process. Mm-hmm.
The screening process through that contractor. But I think that my answer to that would be that the contractor, CTEH, is a software system that will give us the ability to do reviews that are necessary. It's not going to supplant the work that the Department of Health is doing and the work that the committee members are doing in the reviews and assisting in the work to support these proposals and to get these proposals into good grant format. Department of Health has been working with the Black Hall of Fame for a long period of time now to get that proposal so that we know how the funds are going to flow. And DFNA had the opportunity to know about that prior to this meeting.
Right.
So
let me. I guess what I would say is, the consultant will be helping us. They're designing a system to help us track all these things. They'll also give us advice with regard to FEMA and things like that. It's our responsibility to make a decision on whether something fits the CARES Act itself, and whether we wish to fund it. If that's what the state wants to do, and we've got that discretion. It's not a requirement. It's up to us to make the decision. So, but I hear what you're saying, and I think the point that was being made earlier has to do with maybe a broader view of what's out there, and instead of just focusing in on one part of a campaign to alert the state with regard to the COVID and being able to protect yourself on that. Maybe that should be a somewhat larger and done in a larger format where we do the whole state, because we're still having problems throughout the state, and they'll pop up in one place and then pop up in another. And so Representative Allen is correct. We need to get the word out. We need to get it to the young people. And we, it's important that we do that, but it's the entire state is what I would suggest. And, okay.
Yeah, this is Senator Irvin. Yeah, I agree with Secretary Walter, but I'm also asking that question because we were sent a review from the Department of Finance and Administration on the vendor solution proposal that was reviewed. DFNA gave us a recommendation of approval. The Arkansas Black Hall of Fame Foundation, Department of Health, DFNA sent us in writing an approval contingent on Arkansas Department of Health developing specific guidelines, and then also sent us a approval contingency based on the Department of Health's answer for criteria with the Northwest Arkansas plan. So that's why I've only received something in writing on those 3 proposals. That's why I feel prepared. I feel like those proposals we can move forward on because we've gone through this process. The others, we haven't gone through this process yet. So that's why I'm saying what I'm saying, because of what I was sent in an email.
Thank you, Senator Irvin.
Senator Irvin, there's another aspect of this that's somewhat kind of frustrating, I guess, from my standpoint. That is, we've known about a lot of these for some time, most of these for some time, and for some reason we haven't kind of, done the due diligence. The Department of Health or DFA or whoever, there hadn't been a push because we've been working on these other things, and so I think some of this responsibility falls on our back because we haven't really done the groundwork that we need to do to make the decisions, an informed decision on how to spend this money and where the money is needed. But I should have said that. I said that backwards. Where the money is needed and how we should spend it. So, that's something I think I've learned in this process, and we're going to be more diligent in getting these things in front of the correct organization. In this case, most of these, except for one, I think are in the Department of Health. The other one's in DHS, and keeping it on the front burner to get them vetted and decisions made on them.
Thank you. Are there any other questions? And I would agree with Secretary Walther. Thank you.
So, Madam Chair, should we
Yes.
vote on this one today or what? I'm in a quandrum right now. What should we do?
Well, it sounds like from the few people, the people that have talked, some of them have said that they'd like to wait. I know you're interested in going forward, but it sounds like that some of the committee members would like to wait until DFNA has had an opportunity to provide us with a recommendation. And we can ask for that, and we could deal with this in our next meeting, which I would expect to be hopefully next Wednesday, not this coming Wednesday, but the following, if the committee is available at that time and interested in meeting at that time.
So are you saying that what she needs to do is go back and expand her project to encompass the entire state of Arkansas, or what? So what are we asking this organization to do? Because I'm not clear. If the need is there, the need is there. So she can move forward with the $50,000 and still extend it, her reach, because it's not like she's going to get the money tomorrow.
So I think, from my understanding, and committee members, can you stop me if I've misinterpreted this, but it's my understanding that related to the proposal, there's 2 things going on. One, most of the committee members that have voiced their concerns are not ready for a vote because they want it to be reviewed. But then we have also had a discussion regarding the fact that we might want to have expansion related to the communication piece, which I would think is probably not a bad idea. But no one has had that conversation with the Coalition for Tobacco-Free Arkansas. I don't know if they would be interested or willing or able to do that. Obviously, if we were going to expand their proposal, they would, I assume, need more money for that. And so maybe what the best thing for us to do is to not have a vote on the 50,000 today, but to get back with the committee, get back with this organization, have Ms. Love get back with this organization and see. And I have Representative Jean raising his hand.
Well, I'm gonna make I don't know if we need this as a motion or not, but since DFNA has not done the due diligence except the 3, and 2 of the 3 we've already passed, I'm gonna say
What
that.
3 were those?
Well, we've done the Black Hall of Fame, and we've done the secure vendor solutions. And the only other thing that I have before me that DFNA has signed off on and recommended in approval is the Northwest Arkansas Comprehensive COVID-19 Plan. Why don't we act on that one today, since we've already acted on the other 2, and give DFNA some more time to do the due diligence and make either a recommendation or not make a recommendation on the others.
Thank you.
I'll make that as a motion.
Your motion is to have the opportunity now to review the Northwest proposal and table the others. Okay. Is there a second?
I'll second.
Thank you, Senator Urban. All those in favor?
Aye.
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 Thank you. I see a show of hands too. Any opposed? Okay, thank you. So I believe that your motion has passed. Thank you, Representative Jean. So we will, thank you, Department of Health, for providing the information related to Tobacco-Free Arkansas. We'd not vote on that. You'll go back and have that discussion, and then let's move on to the Northwest Arkansas Council proposal from Department of Health. We have additional information. I'm happy to speak to that. Stephanie, would you like for me to start? I will. So I have been working also on some of these proposals. One of the concerns that was raised was related to the Northwest Arkansas Council proposal relating to only Northwest Arkansas. The Northwest Arkansas Council proposal is specifically for the special population of Marshallese and Latinx and the vulnerability there that happens to be in Northwest Arkansas. So I asked Northwest Arkansas Council if they would be willing to expand the contact tracing piece of their proposal to include Yell County as well as DeQueen, the city of DeQueen, which we know have large Latinx populations.
We need to make a change to the city of DeQueen.
Okay.
It's Sevier County.
The whole county, that's
So
fine.
Sevier County has 35% Hispanic
Okay,
population.
that's fine.
I have a question.
Oh, we do have, that is the recommendation by,
Well, okay, because on mine it has city of DeQueen.
Okay,
You got an update then.
well, from
I don't have that.
okay, so hang on just a second, Representative Allen, I just want to make sure that I was, clear. So what we have recommended, or what I am, I guess, telling you that Northwest Arkansas Council is willing to take on the contact tracing for both Yell County and Sevier County based on the special population, the Latinx population. It will cause an increase in the expense for the contact tracing, but we have estimated that to be less than $460,000. So what I suggested, and this is literally my suggestion, so if y'all don't like it, don't take it out on them. But my suggestion was to increase their request to $7 million And then we would work with them to make sure if they end up spending less than that 460,000, that obviously those dollars would come back to the state.
So that's the discrepancy in the original proposal of $6,553,000.
Right, and then that's where it goes to your account.
Okay.
So I just wanted to make sure
I don't have
that
to-
that made sense, or at least y'all could understand what I was trying to say. Stephanie or Sharonda, was there anything else I needed to add related to that proposal from Department of Health perspective?
Secretary Smith, I would say the other thing, last meeting, we heard a lot of discussion from the committee and about the testing piece and the desire to make sure that we weren't being duplicative or providing funding to agencies that have already received funding to enhance their testing. So we did have a conversation with the Northwest Arkansas Council. They clarified for us that it's not their intention to fund agencies like the federally qualified health centers that are already receiving funding for testing. The dollars that they'll receive for testing will be utilized by private providers, UAMS, and others to expand their testing capacity as well. And also, I think, clarified in their responses that the testing services that they'll provide will not be limited to Washington and Benton County. They will pick up an additional 5 counties in their testing area, which includes some of the small rural counties that surround Washington and Benton. And I know Carroll, Newton, Franklin, Crawford, and Madison counties would also be served with that testing that they'll conduct as part of their plan.
Thank you, that's very helpful. Thank you. Okay, I think that Representative Allen was trying to ask a question. I'm sorry that I interrupted you, Representative Allen. I just wanted to make sure that I've got out all the information first. Go ahead.
Thank you. I don't see any difference between what you're doing with number 4 and what we're doing with number 2. What you all did, you approved the proposal for the Northwest Arkansas Council and added money to it. We could have very well done the same thing for the Department of, for the Coalition of Tobacco Free Arkansas. We could have approved that and we could have given them additional money to do a statewide plan. So what's the difference? And I'm just calling it the way I see it. Now, if I'm wrong, you tell me I'm wrong.
Representative Allen, the only difference I see is that DFNA has made a recommendation on these 3. And they, for whatever reason, I'm not in DFNA's office, they have not reviewed and do the due diligence on the others, is what I've been told. And Larry may want to speak to it.
And you know, I don't have a problem. I'm not fussing about it. But we just added another $400,000 to a project, and we got a project over here in Central Arkansas where the need is the same. It's $50,000, and that's such amount of amount of money, and it's serving the same people that need to be served. The ones that's suffering from this are poor people, African Americans, and Marshallese, Hispanics, and other Asian Americans. These are the populations that's been hit the hardest with this pandemic. Now, when it comes to the Coalition of Tobacco Free Arkansas money, I just think that, you know, it's okay for what you all did, but this could have been handled in the same manner. It's not like they're asking for $500,000, and if they need to develop a bigger plan, they can do that. Her organization is already targeting non-minorities, but she just puts special emphasis on it. And we can wait if you want to wait, but if we're gonna do this, let's do it across the board.
I have a question on the testing component of the Northwest proposal.
Yes, go ahead.
Thank you. This is Senator Irvin. Ms. Williams, on the testing portion of that, do you know, what type of testing that they're going to be ordering or equipment? Is this going to be to purchase equipment? Is it going to be setting up mobile testing units? Is it going to be Do you have specific information about that?
Senator Irvin, I don't have specific details on their testing plan. I can get that information. I know they have talked with Miss Casey Cochran in detail about the testing plan. She's our, until recently, she was our regional director in Northwest, and I know they've had discussions about how they would coordinate those activities. But unfortunately, I didn't ask Cochran to give me an update on that. I apologize.
Okay, well, I just appreciate that. And just on the testing component part of this, I mean, there's a lot of poor people all across the state of Arkansas. And they come, you know, and I have a huge majority of those in my area. In fact, Stone County, Searcy County, and Newton County are in the bottom 4 per capita per income. So we can have those kinds of discussions. But on testing, what I'm concerned about is I'm really concerned that we don't have and so I think we need to be prepared to maybe duplicate this system all across the state when it comes to contact tracing for certain populations and testing. And the reason I say that on testing particularly is because, you know, we have some places in our area where testing has been conducted, but Quest, our commercial lab that we generally use, and I'm not badmouth them, they're doing everything they possibly can. But I think they've had a couple of machines go down. But we have had there is a system up here that is reporting 302 tests that still don't have results yet. And people are sometimes waiting 2 weeks for testing results, and that is a huge problem. And some dating back to July 1st that still have not gotten their test results. Today is July 20th. So as you can imagine, you know, contact tracing doesn't work real well when you don't have a quick response in your testing or a quick turnaround in testing. So I really think that our committee needs to have a fuller discussion about testing and how we're going to deal with that across the state and how that fits with contact tracing. Because if you can't test somebody and can't get that result back, you know, then there's really no good for contact tracing to track that down if you're 2 weeks behind schedule already. So I'm really concerned, Ms. Williams, about the testing component across the state and the lack of ability for people to get a test within a good, reasonable turnaround time period. The second concern I have with testing, and I think it's something that our task force really needs to address as a statewide issue, is one, trying to get more rapid testing equipment out to all areas of the state of Arkansas for more rapid turnaround. That's going to make our contact tracing a lot more effective. And then secondly, healthcare workers are being tested over and over and over again. And in some cases, those individuals are bearing the cost of that testing. In some cases, the hospital is, or the clinic, or whatever. And it's really becoming a burden on our healthcare workers. And I'm really concerned we're going to have a lot of people contact tracing, but not enough people caring for patients. So that's a bigger conversation that we need to have. But I think we need to have it in context with this proposal. Because if we need to do a regional approach, then maybe we need to rethink some things and utilize our 7 healthcare coalitions that exist based on bed capacity around the state, or something in that manner. But I just want to bring that up, that, you know, we need to probably be prepared. And that's why my questions were specific on the testing component of this, on the equipment, because I want to make sure it's being spent where we have a quick turnaround, where the contact tracing will actually do good. That's the reason I asked this question. And that's my long comment, but something we were going to have to look at across the state, I think. Thanks.
Thank you. Stephanie, did you need to respond? I think you respond. I think that was just a comment after the question. And then we have a question from Secretary Key. Go ahead, please.
Yeah, thank you, Secretary Smith. So I appreciate the effort to expand this to get some of the special populations that are in other counties. But I would point out, and I think it was mentioned in one of the last meetings, one, you've got Randolph County that has seen a great influx of Marshallese and also Latino after they opened the Pico poultry plant up there. And also Independence County, the Batesville School District, there, I think right now in that school district wide is about 25% Latino. So Independence County's also seen a pretty sizable increase of those special populations. So, you know, I think that's something that the committee just needs to be aware of. And especially as it relates to the Marshallese, if we're trying to get a coordinated effort with those communities, we would not want to leave out that growing community in Randolph County.
Thank you, Secretary Key. And I would like to speak to that. I asked Northwest Arkansas Council if they could expand related to the Marshallese population, knowing that there are additional Marshallese population in Randolph County and potentially in other areas. And the response to that, because of the, and I think the Department of Health may be able to explain this a little bit better, you really need a person on the ground, and Northwest Arkansas Council already knows that a lot of the Marshallese population, and so they're working with existing relationships, and so that's why they were able and willing to be able to handle the work with the Marshallese population in Northwest Arkansas. I agree that we likely need to do the same thing in Randolph County or other locations. Related to the Marshallese, you really need somebody who's within that population to work that. And so I think we can work on that as the next step. Related to the Latino population in Randolph and Independence County, potentially we could request that they add those. The explanation that I got related to that is that those can be done remotely over the telephone. There may be an easier way for them to be able to understand the requests that are being made. But the telephone work with the Marshallese wouldn't work very well. Just so that I could speak to that, but I do agree with you. Stephanie, did you want to speak to that?
Well, I would say to Senator Irvin, her comments are well taken, and I appreciate her discussing this issue with you last week quite extensively. And she's completely correct. Our mitigation strategies that we implement through contact tracing, it doesn't work well if you have delays in lab testing and notification and tracing. It's a coordinated effort. So we definitely need to address access to testing, but then also access to results and linking to contact tracing quickly. And then just to the issue of services from the Marshallese and Latinx community as a whole in Arkansas, through our local health units, we serve Marshall Islanders and Latinx population across the state. In our discussions with the Northwest Arkansas Council, the counties that they can pick up and serve, that gives us the ability to redirect our Marshallese staff and our Spanish-speaking staff to other areas of the state where we know there's also a need. So it does increase our bandwidth and capacity as a state. So I would just add that to Secretary Key's comment.
Thank you. Are there any other questions?
Madam Secretary, this is Larry Walther.
Yes.
I think there's still a response that I need to give to Representative Allen, and where we find ourselves is this has come where is it? The Coalition for Tobacco-Free Arkansas. That issue, I think that's what we're talking about, right?
Talking about the Northwest Arkansas Council piece.
Well, actually, we were on the proposal related to Northwest Arkansas Council, and then Representative Allen asked a question related to the Tobacco-Free Arkansas.
Yeah, no, tobacco, yeah, that's what I mean. We're going back. I want to go back to his issue because we moved off to Northwest Arkansas, and I feel like we didn't close the loop on the tobacco-free Arkansas. Is that okay?
Yes, please, go ahead.
Do you agree, Representative Allen?
Yeah.
So where we find ourselves is this issue is just, it's been out there for some time, and I kind of addressed that a little earlier, but it's just come to the forefront today in my mind. And we hadn't been asked to really the part we do is we look at it to see if it is compliant with, is the request compliant with the CARES Act? Not how it would be implemented, not the merits of actually doing it or not doing it, but whether it can be compensated for through the CARES Act. The second part, how do you set it up? How do you distribute the money? Who's going to monitor all the dollars and ensure the state and this committee that we are accomplishing the objectives that we set out when we allocated the dollars. And that part hadn't been done. And I may have heard it for the first time today. I'm not sure if we've done all the due diligence at the Department of Minority Health. I'm not clear on that. But I'm willing to move forward on doing the evaluation of the idea. Does it comply with the CARES Act? And is it compensatable through that? So the reason we haven't done it is because it hadn't been on the front burner yet, and now I say it is, and we're more than happy to move forward and do our part. But I also think that we need to have the next part, and that is to determine how we will do it and how we get it accomplished, who will do it, and set out those procedures like we did with DHS when we did. When we were spending hundreds of millions of dollars. The same thing with AEDC, with Department of Commerce, when we set up those loan programs and for the forgivable loans and others, there were very, very specific guidelines on how those would be implemented and how they'd be tracked and how they would, and what was the responsibility of the state, what was the responsibility of those who are receiving the money. And I think we need to do that in this one, just like we've done in each and every other one.
Thank you, Representative Walters, for being sensitive to what I was trying to get accomplished with this proposal. Thank you so much. Thank you for addressing the issue.
Thank you.
You're very welcome, sir.
Thank you. Thank you very much. And I do want to clarify that the proposals the Department of Health has that the dollars need to go through a state agency in order to get to these organizations. And a lot of the other proposals that have come to us, when you mentioned the things, Secretary Walter, those were born by the various departments and the ideas came from the department. These proposals have come from outside entities. And so now we're trying to figure out where they're going to fit. And so, it's just a little more cumbersome. And for the Northwest Council, the fiduciary would be the Department of Health to administer that. I think we have a question from Representative Gray, and then I think Representative Jean is wanting to make a motion.
Are you for me?
Yes.
Okay,
go ahead, Representative Gray. Go ahead.
Thank you. I also have a question. In the document that we received, which was very helpful, that addressed a lot of the questions we had last time, it talked about how if we went on the number of active cases that we have right now, we'd need 2,310 contact tracers, and we're only contracted for 1,000. And if I remember right, we only have close to 300 of those in place. I just wondered kind of two things. One, how many more contact tracers would this place in the system, and does the Department of Health think we need to look at expanding what we've already approved to get more tracers on the ground? Because I only expect that our number of active cases will grow.
Stephanie, go ahead.
Thank you, Representative Gray. That is correct. The number of active cases we have now does indicate that we need a higher number of contact tracers, so more than we have been funded for through the CARES Committee. We're in the process of bringing on the second contact tracing provider for the second 350, and in addition to the staff we have at the department, that'll put us over 1,000. The Northwest Arkansas Council, I don't think they have given us the total number of tracers that they are prepared to bring on board, but it was fairly significant. And I'm sorry, I was looking for, I want to say, well, I hate to say a number because somewhere I've misplaced my papers here, somehow looking through all of this. But in addition to the Northwest Arkansas Council, if this is proposed, if they would bring on additional contact tracers, we also have another proposal that the CARES Committee has approved, and that was for the return to campus for higher ed. And in that proposal, there is a component for the College of Public Health to do contact tracing for institutions of higher ed, and they are in the process of hiring contact tracers now and scaling up to be ready when we have the return to campus beginning. Well, it's actually beginning pretty quick next few weeks. So we do have that component, which will also add to our capacity. So at this point, we're not planning to ask for more until we stand up these things that have already been approved and then make a determination if more is needed.
Thank you. Any other questions?
I have one other question, I guess, maybe brief comment question. I think everybody on the committee agrees that that we're all doing the best we can here, but it seems to me that we should have some of these by next week, maybe in writing, about like, what is our plan to have enough contract tracers that meets UAMS's projections? What about testing access and turnaround times? How are we addressing that statewide? What are we doing marketing statewide? I agree with Representative Allen. We got to have an outreach plan for these different segments of our society. Do we have that? Where is that meets the projections that we think we may be headed to? Where are we on contract tracing? We just talked about, but schools also, it just seems like I don't see the big picture plan laid out in front of me so I can know, yes, this fits in, we need to fund this, or we need to fund this more. Is that somewhere that meets with the projection we're on right now so we can put all these pieces together? I'm for the Northwest Arkansas proposal, but we need to be ready for additional testing, quicker testing turnarounds, testing access all across the state also. I want to make sure we're getting that in place with the money we have.
Madam Chairman, Larry Walther.
Thank you. Yes, go ahead.
Senator Bond makes an excellent point, and it might be helpful if the Department of Health could take that comment and maybe make a presentation to the steering committee to kind of help get it in perspective for us, because we're trying to provide resources for the Department of Health and others, and the whole state to accomplish the defeat of this virus, and it would help, I think, bring it together for this committee. So as we move forward, we'll have a better understanding of what the big plan is out of the Department of Health.
Thank you. I think that is great, and I appreciate Senator Vaughn's questions too. So if we can, I don't know what the capacity there at the Department of Health. I mean, I think every day they're doing those calculations, and I think they're trying to get ahead of the numbers, and I think they're doing the best, as Senator Vaughn started, we're all doing the best that we can. So I think that's a good thing to ask. So we'll see if that's possible. I don't know if we have to hold you to it, Ms. Williams, if you could get in touch with Dr. Romero and see what might be possible that you could provide to us so that we know that we're on track to provide the things that are necessary for the state because we don't want to not be ready and not provide the things that are needed.
Absolutely, we'll be happy to.
Yep.
Thank you, and thank you.
This is Senator Irvin. I just wanted to add that I'm chair of Public Health, Welfare, and Labor Committee, and so we are planning to schedule a meeting upcoming in the next week or so with the Department of Health exactly on all of this. But yes, to Senator Bond's point, I think we absolutely need to look at this statewide plan implementation, how the money has been spent, where are we lacking, and I don't want to spend money if we don't have to. I mean, I want to make sure we have money left to spend where something really, terrible may happen and we're going to have to shift a lot. I appreciate that, all those comments. I would absolutely agree. And we'll be having a public meeting upcoming as well. Thank you.
Thank you so much. Representative Jean.
I've got a motion, but before that, I need to ask Secretary Key. Secretary, if we add Randolph and Independence County to the Northwest Arkansas COVID plan, and I know that we're not adding any more money at this time, but we can always come back and do that if we need to. Would that help the situation with the Marshallese and Hispanics in those two counties?
Well, if I may, I think they might be able to handle the Latino, but I don't know that the Northwest can handle the Marshallese, but we could work on that in another capacity.
Yeah.
So just to interject, sorry.
No,
Go ahead, Secretary Key.
Well, I was going to defer to you, Secretary Smith, because I just wanted to point out that there was a population there that we hadn't addressed today. So if we add that here, that's great. But we do need to make sure that that community is covered in some form or fashion, whether it be today or a future meeting.
Okay.
And this is
Thank
Representative Gray.
Yes, please go ahead, Representative Gray. We can hear you.
Thank you. And I know Independence County was mentioned, and I have just a tiny, tiny piece of Independence County, and it would be much appreciated. And I think at least part of my concern, and after receiving the document, I support this initiative much more openly than I did right in the very beginning. But my concern is we don't have in my area, to my knowledge, or up in Northeast Arkansas, any entity like the Northwest Council that can provide all these services. So we have the same needs, but we don't have anybody to help deliver them. So I just want to reiterate, if there's a way that they could do it and help in our areas over in this part of the state, it would be greatly appreciated. Thank you.
Thank you. Okay, Representative Jean, go ahead.
All right, if we're through with the discussion on this, I'm make a motion that we adopt the Northwest Arkansas Comprehensive Plan for $7 million and also include Independence and Randolph counties.
Okay, we have a motion for the Northwest Arkansas Council proposal to be approved for $7 million to include not only Yell County and Sevier County, but also Independence and Randolph counties. Is there a second? Second from
Representative Gray.
Thank you, Representative Gray. Sorry, I couldn't hear you. Okay. Any discussion? Okay. All those in favor of the motion, please signify by saying aye.
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 Thank you. Any opposed? Okay, thank you. The motion has passed. I appreciate that, and I will get back in touch with Northwest Arkansas Council. They may actually be watching to see and talk with them about that. So we have, I guess, concluded the Representative Jean had asked that we review these three, vote on them, and we voted on this, and that we table the others. If I may just give a follow-up, I made a mistake on our agenda related to the Urban League. I left them off, and I don't really know how I did that. But I didn't mean for the Urban League to disappear. And I know that the Department of Health is working with the Urban League as they have been with Tobacco Free Arkansas and the others. And so I think we're good to keep them on our list. So I think we need to do the actions for the committee will be to determine when we will meet again and what we are going to hear in our future meeting. I will let y'all know that I think I got the impression that we would not have a vote on anything else, but we do have Department of Health and Department of Human Services here to let y'all know what they have done, if anyone wants to hear that to date, or if you would rather just have something in writing when things are finalized and they have an actual plan that they can present to DFNA, and DFNA can do a review and potentially a recommendation, so that what y'all will have is a full picture with documentation prior to hearing and seeing that. And so if you want to wait, then that's what we'll do. If you have any requests to hear from anyone, speak up and let me know that. Representative Jean.
Just be clear, 1 through 6 today, we've already heard proposals.
That's
we
right.
have not heard a proposal for 7 or the Urban League.
We have heard from Urban League. We heard from Urban League on Wednesday of last week.
Okay. You just didn't get them on the agenda today.
I just forgot.
Okay.
Yes, it was my typo.
So,
My own secretary right now.
other than the Department of Health, is there any others that have not presented to us that are out there?
No.
Okay.
So we do, and that was going to be my next thing, is we do have the Health Equity Response Team here with the Department of Health available to discuss their proposal. But if you would like to wait, table that and hear it when we're ready to have, if we're ready, when it's been reviewed by DFNA and all that, then we can put that off as well, because I know our timing is getting late. 7 minutes before 5. So the will of the committee. Anyone have any requests?
This is Michelle Gray.
Yes, go ahead, please.
I think in fairness, and I don't know if they can do it in like 7 minutes, but in fairness, I would like to allow them to present just a little bit first before we hear the final presentation from DSS.
I appreciate that. I'll ask for them. Department of Health, if you'll go ahead. So you have 5 minutes. How about that?
Now I'll defer to Director Love. I believe she has been working with the Health Equity Response Team and can brief on this in 5 minutes.
Yes, I have. I've been working with this committee, but Dr. Gloria Richard Davis is here and chaired the committee. So I would like to give her the opportunity to present like the other organizations, and just know that we are in support of working with them through the same process that we would use for the Black Hall of Fame.
Thank you. Dr. Davis, I think I saw you, so please go ahead. Okay, we'll open your mic for you. Hold on 1 second. There we go. You should be open now.
Thank you for allowing me the opportunity to present the committee's recommendations. I think, given what I've heard so far from this committee, that our recommendations and guidelines really does cover a lot of the issues to which you have spoken. The rapid testing, contact tracing, and social isolation, supporting social isolation is a key component of our recommendation, as well as addressing the issues of chronic disease management, because that largely has been basically unchecked. If I can I share my screen with you? Because I've got a couple of slides I want to.
Yes, I think we have to give you approval. So I approve, and Jeremy is doing that too. So go ahead.
Okay, so let's see.
He's nodding, so it should happen.
I'm on my phone, so it's a bit cumbersome for me. I somehow couldn't get into the meeting with on my computer.
Okay. We're working on that screen here.
Okay, hold on. All right, let's see.
I think we're sharing.
You think we're sharing?
Yes, we see your phone. Keep
Okay,
family.
can you see my slides?
Yes, we're seeing your slides flipping through. Yes,
Okay.
go ahead.
Perfect. All right. So, of course, this is the COVID-19 Health Equity Response Team. The team was convened in a partnership between UAMS and the Department of Health. And, first of all, just kind of stating the obvious, we know that we are interconnected as a community and that our health is really inextricably linked to that of our neighbors, family, members of all of our community, members of all of our community delivery. I'm getting an echo. First responders, etc. Our current healthcare, public health, and economic systems, we know, do not adequately or equitably protect the well-being of our community, and that every community is not experiencing harm in the same way. That we have communities, especially communities of color, workers with low income, and people living in places that were already struggling financially, who have really borne the economic burden and disease burden from COVID-19. The organizations, I'm honored to have chaired this committee. It's really an amazing group of professionals from all of these organizations that was convened to address the issue of health equity with a lens from multiple perspectives. We had Department of Health, UAMS, plus a number of nonprofit organizations to also include insurance companies, foundations, etc. So lots of experience and talent came together to create this report. One of the things that we wanted to look at when we start talking about deploying statewide resources is who are the communities, who are the vulnerable communities that really need these resources? And this is a vulnerability map that was created by JDION using about 30 million de-identified records and artificial intelligence, which will allow us to do a deeper look at which communities are really considered vulnerable across the state. I'm not going to belabor the point. We know that there has been a disproportionate impact on the Hispanic community, Black community, and our Pacific Islander community as it relates to not just cases, but also by deaths from COVID-19. If you look at deaths in the African American community, 26% of the deaths are represented, Pacific Island, 8%. When those communities, Blacks only represents 13% of Arkansas and Pacific Island, clearly not 8%, much, much lower rates. We're concerned about the projections from the College of Public Health and other models, which is really indicating that we are yet to experience our peak here in Arkansas. And that with easing restrictions, we're seeing an uptick, and there's not a complete compliance with utilization of masks, which would also diminish the impact of spread. I want to take the opportunity to go through this graph just a minute because it really highlights a lot of the critical issues that we think are important around COVID-19. That first wave we're already familiar with, the immediate mortality and morbidity associated with the disease. And then on the bottom end of that tail, we begin to see some of the impact from resource restrictions and not getting urgent non-COVID conditions addressed. The next waves that we begin to see is that interruption of chronic disease management. We're going to see peaks there. And then that fourth wave, which addresses the psychological trauma, the economic trauma, as well as the burnout and mental health issues that we are certainly expected to see later. So when we look at addressing the statewide need, we're looking at it from both an acute and a chronic disease care access perspective. So what we hope to do is to target healthcare providers, independent clinics, primary care offices, and help to support the patient access for those providers, both from using, and we'll talk about this in a little bit, but using community lay workers to facilitate access, to educate, and to help the offices extend their reach into the community. One of the big concerns we have is for a report from the Primary Care Collaborative, which estimates about 35% of primary care practices may actually close post-COVID-19 pandemic because of their drop in revenue. So with the chronic care coordination, we really looked at this model and patterned it after what is recommended by the Harvard Roadmap to Pandemic Resilience. Testing, tracing, and supportive isolation are critical pieces to making sure that our communities survive and thrive post-pandemic. So we talked about creating team and to manage in place. So the lay health worker combined with a social worker who would create a functional map of resources in the community, and the providers would be linked to that. So we recommend to provide funding for training and employment of community lay health workers to deploy statewide across the region, as we talked about those vulnerability indexes, identifying those communities that would greatly benefit from this service. The supportive isolation or the social support is also very critical because we know that many of those communities are suffering from lack of resources, whether it's foods or social service gaps. So making sure that we're supporting those organizations that's providing those gaps in services. Arkansas United, I think Mariah Reith is on and she can speak to the peer support among community organizations. These are organizations that are already in the community. They already have a relationship with the community that are in place in order to facilitate education and helping to provide a campaign which is culturally and linguistically appropriate for each of the communities that we're speaking to. They're trusted resources in the community. The budgeting that we're proposing, and this is obviously a very high level view of the budget, which we placed into a couple of different subcategories. PPE supplies, when we're talking about PPE supplies, and we talk about the expected increase in incidents, as we know that all of our offices, as well as organizations that we're talking about deploying, will need PPE supplies in order to be able to deliver those services and those cares safely. So that's the first part of the budget. The second part, there was mention of AMDPA. Their proposal was presented last week, and their proposal was actually integrated into this proposal. They have a component where they talk about the technology and reaching communities that have not been able to benefit from telehealth. So identifying at least 5 counties and launching hotspots in those counties, as well as using our lay workers in order to educate patients as to how to access telehealth. And then the third part of the budget really speaks to the personnel and field support that's necessary for us to do that. I think the one piece that I forgot to mention, it was on my slide, but that we're also talking about a coordinated care of the mobile units that are around the state. We've had a lot of conversations around that between UAMS and the health department, and the need for that coordination so that we actually do utilize and leverage all the resources that we have and still reach those communities that are vulnerable and still in need of services. And that concludes what I have to present, and I'll be happy to answer any questions at that point.
Thank you. I really appreciate your fast presentation. Yeah, are there any questions for Dr. Rashad Davis? I will get a copy. I'll ask for a copy of those slides. I'll share those with everybody.
Absolutely.
We did receive a proposal. The slides are a little more detailed, I guess. There's more information in the
Yes.
slides that will be helpful. So I'll share those with the committee. And we do have Mariah on if you would like to hear anything about the peer support professionals. If y'all have questions about that, or if you understand how that would work. I think that would be a very good, that's a very good portion of this proposal that I've learned about. And I think that's very necessary, especially with these special populations. So anyone? No questions? Senator Irvin?
Thank you, Secretary Smith. If we have questions, can we just send them in writing to, is it DHS that's working on seeing where this might occur, or if there's previous DHS programs, DHS, the agency? Is this DHS? What agency is this?
The Department of Health is working with the Health Equity Response Team. And
Yes.
actually, Dr. Romero actually was serving on that prior to his
Right.
Dr.
Dr. Romero started out as my co-chair, and Dr. Brooke Shield-Laurent stepped into that role when he became the interim health director.
Okay, well, I would ask the Department of Human Services to also be involved with this, because there's a lot of these programs. I mean, a lot of this I mean, we've put together some programs already for independent clinics, practice. I mean, what you've outlined is a statewide issue with a lot of people all across the state, no matter where they live or what they look like. And so you've identified that. And again, I think it's important that we make sure that we take, any ideas and generate and see where there needs to be more of a statewide, if that needs to be a statewide response or how we deal with that. So I would just feel a lot better if DHS, because they're so familiar with like Medicaid funding. They're very familiar with the FQHC funding. They're very familiar with where money has already gone from and to and how it's been used. I would just ask DHS to be involved so that we're not duplicating and doing more for some and less for others. Does that make sense? I just want to make sure, because I've had a lot of primary care clinic. I mean, we've had primary care clinics close up here as well. And I mean, you've identified, I mean, your majority of your population is Medicaid population, and Medicaid doesn't pay that well, or Medicare population. So, and they don't have the resources, like FHCs have a lot of resources though from the federal government that they've already received. So I'm hesitant on that issue, but I just would ask DHS to be involved, because they're really familiar with all those funding sources.
And we're certainly more than happy to have that conversation. Director Love served on the committee, and a number of other people who are also familiar with DHS and have contacts. So we'll be happy to have that conversation. As it relates though to the private practices, a lot of the conversation that we've had has also been modification of the offices and protection of their employees, with whether it's with screening or whether it's partition, to allow them to be able to serve a greater number of patients in their office safely, is also included or embedded in this recommendation.
Right, and just to respond, yes, and that was part of a proposal we funded through DHS that they were able to use expenditure money for that purpose. So I think we need to have some information from DHS about that, because we did fund a program for everybody to be able to do that. Plus, we also need to know what AFMC, they have contracts with AFMC to do a lot of that. And I've actually attended them already for clinics to be able to transition to use telehealth services and telemedicine. So I'd like to know more about, where money is already existing being spent too. So again, it's really about process and duplication. But if there are great ideas that need to be statewide, then let's, look at how we do that statewide. I think the idea behind your approach, there's a lot of elderly people that don't know how to use an iPad or an iPhone. They don't have, there are landlines. So literally, we're using telephone to telephone for these services. So, that's a big issue. I mean, that's a really big issue. It's not specific to, like I said, one area of the state. It's a statewide issue. But I would like the other thing I'd say is DHS operates like a summer feeding program. So if we need to, and a lot of these proposals have food insecurity as a part of them, but maybe we need to look at how do we utilize a program that's already existing at DHS to expand it to meet the issues that we have across the state, because it's already got systems in place. It's already got compliance processes in place. So I would just ask DHS if there's a way that we can utilize existing programs and kind of re-equip them for meeting, our response to the COVID, and how we could do that, because they have those things perhaps in place. And then senior centers, Meals on Wheels and senior centers. Maybe this committee needs to look at how we address that as a statewide issue. And so I think there's, I think our job is to really look and dissect and then figure out how we move forward with these proposals. So thanks.
So I think part of why we were proposing the functional community map was specifically to address that question, that where resources already exist, we need to connect it to those vulnerable communities. And some of the programs I'm being told from DHS is ended in June. So we're happy to have the conversation and identify what's still available.
This is, if I could.
Thank you. And there's Cindy Gillespie right there. Secretary Gillespie, go ahead.
I was just going to say, we will be very happy here at DHS to work with Department of Health and with you to take a look at all these pieces. We're also working with AMDPA, which she mentioned, which has some of the same concepts in here. We're working with them on how to do this, and we're working with another group that has some of the same concepts in their proposals. So we'll be happy to work on how all of these come together. And the point about the PPE that Senator Irvin raised, one of the things we will do is go back and look. That was an effective program. If that program needs to be expanded, we can certainly look at whether or not that's the right mechanism to take another look at that, since this is going on much longer than we thought. And then also we are looking, as you all asked, where there are other federal sources of funds that are flowing through DHS and other programs that are federally funded. We are looking to use those funds as well and make sure that we are flexible in looking at how all of these pieces fit together. So very, very happy to work with this group, and
we look forward to that. Thank you so much for that.
Thank you.
So sorry.
Thank you all very much. I appreciate the willingness and the collaboration. Thank you for all the information. Is there anything else from any committee member?
Oh, Secretary Smith, may I just quickly make a quick remark? I know that you're trying to close here, and I apologize. Is that possible?
Certainly.
Thank you so much, and good afternoon to all the committee members. My name is Mireya Wright. I'm a proud member of the Health Equity Commission, founding director, Arkansas United. And I just wanted to offer, because it was an honor to accompany today's committee. And I'm really humbled by the fact that you all have been put in a difficult position, in addition to having to navigate everything within our health system. In some ways, you've been put in the place of funders for nonprofits here in Arkansas, and there are certainly a lot of us. And as I'm here listening and celebrating the grants that you all have just approved to just some excellent peers of ours, I just want to be able to emphasize that there are tons of nonprofits in the state that can also be activated working with minority populations that actually are already structured within grantee networks or in coalitions. Some also managed by the Department of Health, like the Latinx Stakeholders Group. A new group just came together in Northwest Arkansas. And I could really envision scenarios, impossible scenarios, where each of them is individually submitting applications to you all. And hence, as part of the Health Equity Response Team and our work with the Arkansas Minority Health Coalition, using that same study from Harvard and their roadmap, they have suggested a model called peer support providers. And it's one through which we have the opportunity, I think, to move funds, again, leveraging networks that already exist, already have those relationships with a vulnerable population, and just be able to start applying add-on fundings to work that they're doing now, to really give them focused training and support to be able to be more effective allies in the process to you all in the state. Because that's really, when I hear about the amount of money that you all have just approved for contact tracers, I can tell you, as an organization that comes from a base of 800 immigrant workers, we have come to learn that many of our members have been giving wrong phone numbers to the Department of Health and addresses because of fear in this moment of just sharing any information. And the reality is we're going to need deeper partnerships than ever to be able to fulfill the potential of the programs and investments that you're fulfilling. And again, our hope and aspiration, we were just a few groups that were part of the Health Equity Response Team, but there really are wonderful organizations around the state that I think, again, in partnership with the Arkansas Minority Health Commission and the Arkansas Community Foundation, has also signed on as a ready partner to help navigate these grant networks and organizations. We can get groups working right now through a model that we've piloted with Walmart Foundation funding to be able to support this effort. And so I really hope maybe in subsequent meetings of this, we were grateful the Health Equity Response Team gave us a home for this idea, and hope that you all may continue to be open to listening to this suggestion. But we really do take on that all of us have an opportunity in this moment to be change agents, to work along the state in this process. And I think that there's some quick investments and tools that can support those efforts. So thank you.
Thank you. Thank you very much. I appreciate that. Appreciate your time. I think we've run out of time for the committee, and I will let the nonprofits know that the federal government has opened up the opportunity to apply for the small business type loans through the federal government as well. So thank you all. I appreciate it. If you have any other information that you need to pass along, please feel free to email that to me or find us on the governor's website.
I wanted to just make sure that we know the fiduciary agent for this is the Arkansas Minority Health Commission.
Through the Department of Health, yes.
Yeah,
that's
we've
correct.
had multiple conversations around access and with other nonprofit organizations who can very quickly actually increase their capacity to do the work.
Thank you. Thank you so much. I appreciate everybody's time. Great to see you all. Thank you, members. Good work today.
Thank you, guys. All right. Bye-bye.